Hi everyone, and welcome back to Shippadall Registered Nursing. My name is Janisha Shippadunkley. Welcome. Subscribe, go ahead and click that subscription button and subscribe to Shippadall. Subscribe. Did you subscribe? If you didn't, well, you need to. Alright, so today I will be talking about tips that I use to study for my Nclex, to prepare myself for Nclex in 2021. I recently passed, so this is fresh new information. Okay, I passed July 24th. That's when I did it, but I didn't find out about my results until I think the 27th or the 28th, somewhere there. And I paid the fee online to get my unofficial grade. Okay, and it was a pass. Alright, so today I want to talk about the first thing I want to say to you, because the first video that I did, I've seen some comments and my heart goes out. There's one specific comment that I want to talk about, but I'll talk about it in another video because I didn't want to lose track of this video. Alright, so first thing first, you need to believe in yourself, because if you don't believe in yourself, who is going to believe in you? That is tip number one. Believe in yourself. Believe that you are going to pass, that you're going to go in there and that you're going to pass. If you failed before, please leave that behind. Leave that failure behind and move forward. You have to get up, you have to brush yourself off, and you have to go again. But remember, this is what I keep telling people. You cannot go back the same way you went before. Okay, you need to look into yourself. What can I do different? Where did I go wrong? Ask yourself those questions. Evaluate yourself just like you would do in the nursing process. When you have to reevaluate your patient, you have to write your evaluations. Go ahead and assess yourself. What can I do differently the next time around? Because you believe you studied and you did everything. And yes, we have that faith, we have that confidence. But at the same time, if we fall short, now this is the time to evaluate yourself, to assess yourself, to see what you can do differently next time so that you can be successful. And keep going. Keep going. Do not give up. Don't lose hope. Don't lose faith. Just be stronger. Let your failure makes you stronger. This is what is going to take you through life, because sometimes things are a process. You're going through a process, and you have to use things that happened to you in the past to become a better person. Okay, tip number one. Tip number two, I just want to tell you, a matter of fact, it's not even a tip. I want to tell you the resources that I use. I use UWORLD and I use Mark Clemens videos. That's what I did. During my school, we use Kaplan, but I'm not a fan of Kaplan. I just don't like the way their explanations are. It's just not for me. You know, different strokes for different folks. Maybe it helps someone else, but I honestly don't believe it was something for me. Yes, baby. But what happened? So that's my daughter. Come say hi.
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 My name is Janisha Shippadunkley. Welcome to our video.
What's on your mouth? Welcome to our video. Tell them to like, subscribe, and share this video. It's my little doctor here. She want to be a doctor. Alright. My friend and I, we split the cost because the UWORLD is expensive. So what you can do is split the cost with a friend. So my friend and I, we split the cost. We bought the one that gave you 2 evaluations. So we share the password and everything. She did one of the evaluation, I did the next one. Okay, so we can see where we're at. Also, when you're doing those evaluations, don't let yourself, you know, like feel, how should I say it? Feel discouraged. Don't feel discouraged because of the score that you're getting while you're testing, while you're doing your practice questions. Don't be discouraged of those scores. Don't let those scores discourage you, because at one point that was happening to me, and I have to tell myself, I'm not gonna let these scores discourage me. I'm just gonna keep practicing my questions. So go ahead, get that UWORLD, invest in UWORLD. I'm telling you, questions that I did in UWORLD, I saw it back on Nclex. It was so weird. Like, I truly saw it back on Nclex. UWORLD, they're winning. So again, don't let those evaluations discourage you, because let me tell you what happened to me also. When I did the UWORLD evaluation, it told me that I had a low chance of passing. So I was thinking maybe I did it too soon, because listen, this was happening very fast. I actually only studied for 2 weeks. 2 weeks, and I wasn't planning on taking it, but the dates, my friend kept encouraging me to take it, because she's like, what's the worst thing that could happen? You know, if we fail, we just do it again. At least we get the experience. So I had just lost my sister in May, and you know, I was very broken and everything, and I just didn't know if it was time for me to take it. But she really encouraged me to take it, and I'm telling you, it's good to have a good study partner or a study friend, because it definitely will help to take you through during times when you're kind of undecisive of certain things. You know, you both can help each other out. You have a question, they can answer it. They might have a question, you know, you can answer. So that is very good. So that's actually an excellent tip, to have someone that's going through the same thing like yourself, because each one will help the other. You know, no man is an island, no one stand alone. It's good to have someone close by that's going through the same thing, the same process as you are, and they can help to bring you over. Don't use your experience in nursing school saying, oh well, I'm a 4.0 student, so I'm just not going to prepare, I'm not going to do anything, I'm just going to go ahead and pass my test. I mean, maybe some people are lucky that way to go ahead and do that, but still at the same time, you can use that to assess your readiness, that you are ready to take the test, because okay, you passed through nursing school. Because I'm telling you, a lot of nursing students that you look at and you probably judge them, so wow, she's brilliant, she's bright. They go in Nclex and they come out and they fail, and the person that was sitting at the back that you believe wouldn't pass at their first time, they go in and they accomplished, they did it, they passed the first time. So don't, you know, judge others and judge yourself that you're ready, because oh, I was getting a lot of A's in nursing school, because a lot of A students go in Nclex and still fail. Alright, so just prepare yourself, do those questions, try to do at least 1,500 questions. If you can do 2005, I did 1,600, around there, 15 to 1,600. And I'm telling you, invest in UWORLD. Invest in UWORLD. I really want you to invest in UWORLD, because I'm telling you that it helped me. Mark Clemens did help me. I watch his series, I listen to them while I'm driving. I will listen to them. The prioritization, Jesus, I can't say that. Prioritization. I know I still didn't say it right, but I'm going to move on. You can judge me if you want to. Okay, so for the priority questions, we got a lot. Watch Mark Clemens' video. I watched that thing like maybe 3 or 4 times about prioritization. Okay, I'm going to link it below, because on another channel that I have, I had uploaded that video because I loved it so much and I wanted to save it. So I'm going to link it below. Watch that video, because I'm telling you, most of those questions on Nclex is about prioritizing for your patient care, you know. So go ahead, watch that Mark Clemens. Watch it. Use your test taking skills that you learn, you know, while doing nursing school, while going through nursing school. Use your test taking skill, use your knowledge, use your ABC when you're answering your questions while you're doing your Nclex. Use your knowledge. The only time you guess, because questions are going to arrive that I'm telling you, you will definitely have to guess it. But first, use your knowledge, use your test taking skills, use your ABCs to reach your answer. Remember to try to eliminate as you go, priority at all times in all your questions. Most questions you definitely have to prioritize. I'm telling you, prioritization is a big chunk of the Nclex, so you really need to do the practice question, because that will help you to flow. When you do a lot of practice question, it will help you to flow. And do some teach back. When you learn something, kind of teach it back to yourself, like speak it back to yourself, or tell it to someone, or speak it out while you're driving, and when you do the UWORLD, remember to read the explanations, like why is this question wrong, why did I get it wrong, why did I get it right. Go over each question and read, and so you can get the knowledge and understanding, because you're not trying to memorize this question to go in Nclex. These questions are just there to prepare you, to help you to flow, and to get increase your knowledge, increase your understanding, so that when you go in the Nclex you can excel. All right, when you go to take your Nclex, tell yourself that today is my day. I am passing my Nclex today. I am going to be certified to work in New York, New Jersey, North Carolina, wherever you are, wherever you're testing. Tell yourself that. Speak to yourself, because when you go in there and you believe and you trust and you have faith, that will help to calm you down, so you're not that anxious, because sometimes it's nerves while people fail. It's not that you don't understand. It's not that you can excel. It's because of your nerve, because you get so nervous while you're doing it. You're so anxious. You failed before, and you bring that same failure in with you, and you bomb the test. Okay, so you have to learn to get over that anxiety, that test taking anxiety. Another thing I want to say, guys, is if you have had previous experience in the healthcare, don't really draw it in that experience while you're test taking. Use the knowledge that you got from school, because I'm telling you that I have had experience where I get questions wrong, because I worked in the healthcare system in the hospital for 5 years before nursing school, and I kind of bring those experience in, and then I end up getting questions incorrect because of that. So experience before is very good, but you have to know how to control that. You have to learn how to control, not bringing in past experience into your exams. Okay, one more thing that I want to talk about is just try to learn how to control your stress level when taking tests. Even taking some deep breaths, just try to relax yourself, calm down, say a prayer before you take your test. Speak to yourself in some way, try to develop stuff to calm yourself. While you're practicing your questions at home, practice doing that also, because if you practice at home to keep calm while you're taking those tests, when you go into Nclex, those same behaviors, they're gonna take place in there. Okay, so learn to control your stress level at all times. I know I've said it before, but I want to say it again. Please invest in study resource. I did UWORLD. Maybe there's another resource that someone told you about that you want to try. If you know the type of study style that suits you, because each of us are different. All right, I am a visual learner. When I study, I love to write. Like, I like to see it. Like I have to see it. So I'm a visual person. I need to feel it. I need to hold it. I need to see it. Whenever I don't like ebooks, I want the book in my hand. I want to skip those pages. Whenever I'm studying, I would like write and I draw like graphs, you know, stuff like that, like arrows going to that one, pointing there. That's how I learn, and whenever I do that, I notice that I always excel in my exam. I always do good in my exams. Next thing, you know, some people are auditory learners. There's plenty of lectures on YouTube. Listen to more Nclex. Listen to I used to listen to what's her name, Sarah, registered nurse. She's very good. You know, find some good YouTube videos, listen to them, keep going over, you know, because once you keep hearing something, it's like you get to know it, you know. It's like listening to music, to a song. You keep hearing it till you start singing it. So keep listening to those lectures until you can sing them, and then you'll become knowledgeable. I know I was missing something. Your study plan. Have a study plan, no matter how short the time is. I did mine in 2 weeks, but please, let me come real close and personal. Have a study plan, okay? Get a study plan, write a study plan on Monday. This is what I'm gonna start with. I'm gonna try to do at least 50 questions today, 75 tomorrow, 25 questions in the morning early when I get up first thing before work. Then I'm going to do 25 when I get home from work at 5 p.m. Make a study plan. Even if, you know, things don't always go as we plan all the time, but at least it's something to guide you, to help you to accomplish your goal. So make a study plan. Even if you fall off track, don't be mad at yourself, because I did. Sometimes I say, oh, I'm going to try to do 75 questions today, and I end up doing 50 or 40 something. You know what? Still, I kept going anyway. You know, so make that study plan. Try to do as much questions as you can possibly do. There are days when I had to do over 100 questions, you know, because I really wanted to hit that 1500 or that 1600 point. So do what you got to do. Do those questions. Practice questions make sense. Anyone can tell you that practice questions make sense. Making a study plan, using your knowledge during Nclex. Don't just guess everything. Don't just go to guessing. First, try to use your knowledge. Try to use your skills, your nurse intuition. After everything fails, that's when you use your nurse intuition and your critical thinking. Alright? So I say to you that you didn't come this far to turn back now. You went through hell in nursing school, because that was hell. You know, nursing school was not easy at all. I've had times when I failed, but you know, I get up, I brush myself off, and I kept going. And I'm just encouraging you, the same thing you did in nursing school to keep afloat is the same thing, the same strategies you're going to use to accomplish and to, you know, win this thing called Nclex and pass it. Okay, so believe in yourself again. Have some faith. Faith without work is dead. So work hard, have faith, believe in yourself. The first tip I gave is to believe in yourself. You have to believe in yourself. Get a study partner, get someone, make some friend in nursing school, and get through it with them, because no man is an island, no one stand alone. Remember to like, subscribe, share the video, share it with someone in nursing school, you know, someone that can be that needs a little encouragement. You know, we have to stick together, okay? In times like this, we need each other. We need someone to encourage us, and it's good influence. So come on over, subscribe to Shippadal Registered Nurse. Visit my website, shippadal.com. Shippadal is my personal brand, and it was birthed because of nursing school. But you know, I will give you all that information. Once you stick with me, you will know why Shippadal is Shippadal. Alright, so thank you. Stay tuned for more videos. Remember to like, subscribe. Bye. See you soon.